So we're talking about the patellofemoral joint, the kneecap joint, between the kneecap itself and this little groove that it rides in at the end of the thigh bone. This is a joint that can give people a lot of problems, and there's a lot of ailments that can affect this joint. The thing to understand about this is a very high stress joint. The cartilage coating in this joint is some of the thickest cartilage of any joint in the body. And the reason for that is that this joint has some of the highest stress on it of any joint in the body. The quadriceps muscles, the muscles in the front of the thigh attached to your quadriceps tendon that goes through your patella or your kneecap and then attaches down onto the shin bone down in through here. Those are very strong, powerful muscles that exert a lot of force on this area. One thing that can happen is those muscles can get very tight over time, and what that does is it puts tension in the tendons, making them more irritable, but also creates a situation where you're essentially taking that patellofemoral joint and tightening it. The kneecap gets bound down in that groove, and that can cause a lot of pain. Some of what we're trying to accomplish with therapy is to help loosen that up, both the muscle attachments, loosen up the muscle that reduces tension on the tendons, and then also loosen up the ligamentous attachments around the kneecap that can get bound down as well. A second thing that can occur is that people can actually have looseness around the patella. The ligaments that stabilize it can be somewhat loose and lax, particularly if someone has generalized loose jointedness. And this can cause extra motion in that kneecap joint that can also cause irritation. The goal of the strengthening exercises is to help strengthen them and stabilize this kneecap somewhat and help some of the irritation that comes from that extra motion go away.